So she doesn't like her earlobes here, which are become more flimsy and stretched out because of earrings, heavy earrings. Did you used to wear some really big earrings?
Yep.
Back in the day, huh? So she has these stretched earlobe holes that I'm going to try to remove. She wants to really take off a good amount of the earlobe, especially this side's actually a little longer than the other side, so that's why we're doing that here. So it's always really important for me to mark it out. And you okay? Make sure never hurting you, okay?
Yeah. Are you doing something? I don't feel anything.
Well, you should. That's good. If you felt anything, you must tell me, okay? Let's take a look at it for a second here. Just loosening a little bit here so that we can reattach the edge. She had a little bit of a flimsy earlobe, so normally I would thin the edges down on somebody who doesn't have a little bit of a thinner earlobe, but like thin these edges down so I can turn them under, but I'm gonna leave them like that because I think if I do that, it's gonna thicken that earlobe a little bit. Make it a little bit nice and thick. See a little bit of skin edge. This is this part of her earlobe, earring, her previous piercing, and if I don't remove that, we can't close that side to side well. Make sure this stays up. Get this stripped off right here. Okay. A stitch right there. Let's see how it looks.
About 20 years or 23 years ago, I had my neck pulled up a little bit, so maybe that's why one ear is a little...
Yeah, that could be the case, very much the case.
Yeah.
Or it could be that you're just naturally, I mean, we're asymmetric.
Yeah,
so,
I was going to say,
that.
everybody has one side that's...
This woman, we have a little relationship. She's the hairstylist. I can tell people that, right? No? She wanted for private? Do you want people to not know if they watch this video who you are?
Yeah, you don't have to.
I'm not going to say your name, but I was going to say your occupation. But no, okay. I'll be like this. How about this? You're a hairstylist for a network.
Yeah.
One of the big networks. So I got to know you because I would go on these shows. Takes good care of me. She was the one that put me in all these cute little like braids and things like that. She did a lobster tail once. She called it.
Yeah.
I bet you girls have never put your hair in a lobster tail.
No, I never heard of that.
I think she invented it. We're just putting these stitches in right now. And we'll see you in like 1 week to take the stitches out. You okay now? Now you're getting relaxed. Okay, I like to see that.
Well, I've only been up since 2.
Oh, goodness sakes.
I was so nervous that I wouldn't. So when I got here so early,
Are you starving now?
No. I walked over to Carl's Jr. I had the nicest cup of coffee and a biscuit.
Oh, good.
Everything.
It's like, but how come you're not worried about going home? You're like, I'm fine going home. Just worried about coming here.
Yeah, well, and because I didn't know if I could find it.
Got it. Oh, you're so
But your husband, he wrote everything, or he gave me such good directions the last time I saw him.
Oh, he did?
Oh, yeah,
I kept those.
Oh, yeah.
That was a while ago he came to the set one time. Yeah.
Absolutely.
Wow. I mean, seriously, that was a long time. He'd been to the set once, like few years, into it.
I held on to that paper.
Oh, wow. It's pretty cute. All right, almost done on this side, okay? Now, when you see it today, it will be bumpy today and a little swollen, so ignore that.
Okay.
Okay, we'll put a little nice little bandage on here. But when we see in a week, it'll be much better. It still might be a little bit kind of, sometimes you get a little bruise on the end, or it's a little bit
It's okay.
scabby kind of in the end, but ignore that. That goes away too. It takes a few, you know, it actually takes like full 3 months for it to really get to like what it's going to look like, you know, because it's a little, it's still in the healing process. It can be a little stiff and bumpy.
Yeah, yeah.
But it looks like it's going to do real well.
Do you want me to come back at any time?
You don't have to. You can, you know,
Oh,
we have friends on Facebook. You could send me a picture if you need to, or we'll see. You know, I'm not going to say you have to, but if for some reason you need to.
No. I just.
No, we do want to see you to take the stitches out. Unless you want to have somebody take it out for you.
No. I'll come.
That's like a week from now.
Okay.
And it can be a short appointment. Now you know that you don't have
Yeah.
to come out so early. You won't have to be up till 2, I think, for that appointment.
I have to leave for 2 at work from my house.
Let me just see this. See this little edge part? I need to trim out. Very, very little edge. Right here. Oh, these are my, these are like my scissors for eye lift, I think. Nice like that. Good. I like it. Okay, one down. One down, that wasn't so bad. I'm going to switch sides now. We can stop that for a minute. So this earlobe is a little smaller, perhaps naturally. Okay, yeah?
Mm-hmm. Took a second to focus,
okay.
but it's good now.
And you okay now still, right?
Uh-huh.
Okay, good. And so, you know, see that, there we go, that little piercing there. It's a little higher, so.
I had like 2 holes in every.
You do. One of them, it doesn't look like one of them you're using too much. It looks
No.
like smaller, huh? It doesn't seem stretched out like the other one. See, so again, I'm gonna leave that. I'm not gonna debulk it like I do sometimes with others that I might trim this. But here, this one right here, actually, it's still there. So let me try to remove this ear piercing here. See if I can't close that hole like this.
What does it mean? Oh,
No, you're okay. That was
can
my
I
stomach
talk?
talking to you. Yes.
It's not going to go on the thing, right?
I can delete it if it's something private. I will delete it. Don't you worry.
I just wanted to know what happens when your back itches all the time.
Oh, when your back itches?
Yeah. Is there anything?
I don't.
Like
there's so many things that could cause that. I mean, it depends if there's something there.
My gland always itches.
Yeah, but it's not a gland.
Okay.
It sounds funny when you say that to me.
It's
It's an epidermoid cyst. People.
Bless you.
People or even other types of doctors, not
Yeah.
dermatologists, they might call it a sebaceous cyst,
Yeah.
but it's not a gland. They might
Okay.
call it sebaceous cyst, but it's actually not sebaceous.
Okay. I don't know.
So
what
that's
that
a misnomer, but it's called an epidermoid or cyst.
is. Okay.
I would just call it a cyst. See, now that piercing that she has wants to make this area pucker, so I'm gonna try to trim that a little bit, make sure it doesn't. It's gonna want to do that though. Sorry. Trim this a little bit. Okay, good. All right, let me get that now. I don't think I need to fuzz it, huh? Looks good. This mess is no good when you have allergies. My nose is running under it. So yeah, I mean, you know, that cyst you have, that's what we do here. We take those off when we film those. So usually, you know, we could do that if you want to.
Well, I don't.
At another time when you gain my trust
how
here.
much?
Normally I would say, I mean, that might be about like $5. But we give you
I'm gonna, well, you know, I have
You ask Kaiser first.
I have an appointment.
Come
next
back a little
month.
towards me. A little turn. There you go.
And
kind of sliding away
she's
from me.
always said, she says, we don't have to do it unless it bothers you. And the thing
You
that
can say it bothers you, but
me-
I don't want them to just squeeze it. They have to
I
actually
don't-
put stitches there.
I don't
Okay, they have
do
to cut it
no,
out.
I don't. I have a little mold above it, and everybody says, oh, you gotta see a doctor, but I don't think so.
Well, I'm sure she's seen that. If
No,
she's looking at your.
no.
Why don't you show her your cyst?
I just got it. I mean,
cyst?
well,
no, you've had it for
no,
a
no,
while. Oh, the
above
mole.
that. But to me, it looks normal. I don't know.
Well,
But I'm going to ask her because you know what bothers
away from
me?
me.
Every time somebody gives me a hug,
yes, I know.
they're
You
like
feel
this.
it. Uh-huh.
Or I wear a shirt. It's
Yes. That might be why you wear these longer shirts. Huh? A little looser.
no, they're to
Okay.
cover my body.
Oh, okay. You're too cute. I love it. Christy's like way into this. She's getting all artsy.
You had a lot of people in here this morning. You were
Did.
busy.
Yeah.
What do they
Yeah, we
get?
don't mess around here.
They come in and out.
Oh yeah, all the secret stuff. Secret
Oh.
stash out here.
Botox and all that stuff.
Maybe. I can't say.
Well, I don't know
I
those
can't
people.
tell people. Yeah, just kidding.
I mean, you know, I'm just wondering because they're in and out.
Well, it depends. I mean,
Yeah.
they're all here for medical. They could be
Yeah.
here for skin cancer monitoring. There's some
Uh-huh.
people that probably look like they get filler and Botox, but some people don't look like they get it, I'm sure, you know. There's
Yeah.
like a bunch of us here. There's me and Dr. Rebish and,
Oh, uh-huh.
and we have two PAs.
Mhm.
We have a new nurse practitioner who's training with us now. So,
It's a lovely office.
oh, thank you.
And your husband works here too?
Yeah, he's here right now, I think, somewhere.
Jeff, right?
Uh-huh.
How's your house coming?
It's good.
Are you in it?
Yes, we are in
I
it
saw
now.
a picture.
Oh, you
Good
did?
Lord.
Oh, just the
On
yard.
Facebook.
You mean, yeah.
Is it around here
Yeah, it's up
in the
hill.
mountains?
Oh, yeah. Okay, it's almost there. Take a look at this. One more, I think, right there in the front. I get neurotic about putting my sutures in. I want to almost put like too many here because it evens it out more. Less bumpy in appearance too to the patient. If you have any advice for me too, Christy, as to how I should move, you know, for you, that's
What?
fine too.
Are you telling me?
Oh no, I'm talking
Oh.
to my girl here. Good. I think I need to trim that right tip there. See how it wants to scooch out a little bit.
As long as it's okay that I'm like moving around.
No, I
you,
don't mind
doesn't
it.
bother
I
the
don't mind at
video,
all.
then-
Mm-mm.
No, you're fine. Because I can move around you. I like how it has a longer handle.
Yes,
I'm not
isn't that,
breaking my
isn't
arms.
that yes?
Your arm's not
And then you
Yeah.
could you could stabilize your arm
Yeah.
against you. That's the worst part about it, huh?
Yeah.
Are you zooming in and out?
No, I don't really have to because the video is
It's
pretty
very
close
short,
up.
crisp.
It's
Yeah.
pretty, yeah. You just have to keep like making sure it's in focus.
Yeah, I
Sometimes
think I
it
need to
wants-
figure out how to do the manual.
Like do an autofocus? Yeah.
Yeah.
It's an auto, right? So I need to like learn how to do manual so that this is running, you know, so that it won't go in and out. Because every time my hand moves in, it like will try to focus on my hand.
Yeah.
Sorry, your hair wants to be involved. There we go. Can you clean this off and not? I'm gonna take a napkin picture of her.